Where does the voice in our head come from while we are reading? Most of us will be familiar with the experience of silently talking to ourselves in our head. When you are reading a story, you might hear the voices of the characters, or even you may interact with them. If you have got an important meeting with your boss later in the day, and you are simulating silently in your head how you think the conversation might go, possibly hearing both your own voice and your boss's voice responding. This is the phenomenon that psychologists call inner speech. This refers to the sense that you can hear yourself thinking. This is that silent voice that narrates your day-to-day activities. When you imagine what you might say to someone and their response, you are hearing a voice of sorts, but you know it is not an actual sound. There are many theories about this, but no definitive answers just yet. Psychologists been trying to study it pretty much since the dawn of psychology as a scientific discipline. In the 1930s, the Russian psychologist Lev Vygotsky argued that inner speech developed through the internalization of external, out-loud speech. If this is true, does inner speech use the same mechanisms in the brain as when we speak out loud? This type of auditory imagination is a bit like visual imagery, where you can imagine what something might look like without actually seeing it. Another phenomenon mentioned in other answers is subvocalization. An act of reading actually activates the muscles in the throat, vocal cords, and sometimes the lips. When we learn to speak, we learn to make sounds with our mouths. Learning to read often involves reading out loud also, in which case we hear our own voice. As vocalization is suppressed in order to read silently, the muscles may still move slightly, and we hear what we know we would sound like if we were to speak out loud. We have known for about a century that inner speech is accompanied by tiny muscular movements in the larynx, detectable by a technique known as electromyography. In the 1990s, neuroscientists used functional neuroimaging to demonstrate that there is a nerve bundle in the brain called the arcuate fasciculus that connects the Broca's area, speaking part of the brain, to the speech understanding part or Wernicke's area, which are active when we speak out loud, are also active during inner speech. This nerve bundle seems to play a role in the experience of inner speech. Furthermore, disrupting the activity of this region using brain stimulation techniques can interrupt both outer and inner speech. So the evidence that inner speech and speaking out loud share similar brain mechanisms seems pretty convincing. What is the importance of accurate understanding of what is going on in our brains when we use inner speech? Understanding typical inner experience may be the key to understand more unusual inner experiences. Psychologists have argued that hearing voices or auditory verbal hallucinations might be a form of inner speech that has not been recognized as self-produced. Neuroscientists have found some evidence in favor of this theory. When they scanned the brains of people who reported hearing voices, they discovered that many of the same areas of the brain are active during both auditory hallucinations and inner speech. Broca's area, the speaking part of the brain, is often active in people when they are hearing voices. If we really want to know what the difference between what happens in the brain during inner speech and voice hearing and how inner speech might become hearing voices, then first we need to understand what our internal talk is usually like. A recent study by researchers in Finland attempted to address flaws in previous brain imaging studies of inner speech. Using functional magnetic resonance imaging, they studied the difference between activity in the brain when participants experienced an auditory verbal hallucination, and when they deliberately imagined hearing the same voice. They found the main difference between the two conditions was the level of activation in a cortical region known as the supplementary motor area, which contributes to the control of movement. When participants heard voices, there was significantly less activation in the supplementary motor area. This fits with previous hypotheses suggesting that recognizing actions as one's own might rely on signals from motor cortical areas reaching sensory areas of the brain. These help people who are distressed by it, and when there's a need for psychiatric care. But to help them, we first need to know what typical inner speech is like, and the underlying neuroscience is part of that understanding. Peter Mosley is a PhD student in the psychology department at Durham University, working with the Hearing the Voice project. The Hearing the Voice Project is conducting a survey in collaboration with the Edinburgh International Book Festival to explore the ways readers imagine, hear or even interact with the voices of characters in stories. Thank you.